Imagine feeling sick, but instead of going to a modern hospital, you are taken into a dark medieval room lit only by flickering candles. There are no machines, no sterile tools, and no clear understanding of what is happening inside your body. Instead, people rely on beliefs, traditions, and strange ideas about how the human body works. In medieval Europe, medicine was not based on science as we know it today. Doctors did not understand bacteria or viruses. They believed illness was caused by an imbalance of bodily fluids known as the four humors: blood, phlegm, black bile, and yellow bile. If one of these was out of balance, the body would become sick. To restore health, they used methods that might seem shocking today. Some treatments were painful, others were disturbing, and some were simply bizarre. Imagine a doctor deliberately cutting a patient to make them bleed, believing it would cure disease, or placing strange substances on the body, hoping to draw out illness. In some cases, people even turned to animals, superstition, or religion as a form of healing. But despite how strange these methods seem today, people truly believed in them. These treatments were not considered unusual at the time. They were the best solutions available. And in a world where death from disease was common, people were willing to try almost anything to survive. Medieval medicine was a mix of science, superstition, and desperation. It reflected a time when knowledge was limited, but the need to heal was just as strong as it is today. In this video, we will explore some of the most bizarre medical treatments from medieval Europe. From bloodletting and leeches to strange remedies involving animals and prayers, these practices reveal a fascinating and sometimes unsettling side of history. Imagine feeling unwell in medieval Europe and deciding to visit a doctor. Instead of receiving medicine in the modern sense, you might be offered a treatment that was considered both normal and highly effective at the time: bloodletting. Bloodletting was based on one of the most influential medical ideas of the past, the theory of the four humors. People believed that the human body was governed by four essential fluids: blood, phlegm, black bile, and yellow bile. Health depended on keeping these elements in balance. If one of them became excessive, illness could occur. In this system, blood was seen as one of the most important components. When a person developed a fever, inflammation, or certain other conditions, it was often believed that there was simply too much blood in the body. The solution, according to medieval medicine, was to carefully remove a portion of it. The procedure was usually performed by a trained practitioner. Using small specialized tools, they would open a vein in a controlled way and allow some blood to flow into a container. The process was done with intention and according to established guidelines. In fact, there were detailed charts that helped determine which area of the body should be treated depending on the illness. There were also alternative methods. One common technique involved placing cups on the skin to create suction. This method, known as cupping, was thought to draw unwanted substances toward the surface without requiring deeper intervention. Bloodletting was used to treat a wide range of conditions. From fevers and headaches to more complex illnesses, it was considered a universal solution. People from all levels of society, from ordinary citizens to royalty, trusted this method and turned to it regularly. From a modern perspective, we understand that this treatment was not always effective and could sometimes weaken the patient. However, at the time, it represented one of the most logical approaches available. Medical knowledge was limited, and practitioners relied on the best theories they had. What makes bloodletting especially fascinating is not just the method itself, but how widely accepted it was. For centuries, it remained a central part of medical practice. It reflects a time when people were trying to make sense of the human body with the tools and knowledge they had. Today, it stands as a powerful example of how medicine has evolved, and how even the most unusual practices once played an important role in the history of healing. Imagine visiting a healer in medieval Europe with a common problem such as a toothache or skin irritation. Instead of herbs or simple remedies, you might be offered something far more unusual: treatment involving mice. While it may sound surprising today, animals were often used in medieval medicine. People believed that certain natural properties could be transferred from one living being to another. In this case, mice were thought to have special healing qualities. One of the most well-known uses involved toothaches. A common belief was that placing a mouse, often prepared in a specific way, near the affected area could help draw out the pain. In some traditions, the mouse symbolically absorbed the illness, taking it away from the patient. In other cases, mice were used for skin-related conditions. Healers would apply mixtures that included parts of small animals, believing these substances could help improve the condition of the skin. These treatments were based on the idea that nature provided everything needed for healing, even in unexpected forms. To modern viewers, these practices may seem unusual or even uncomfortable, but in the medieval mindset, they were part of a larger system of beliefs. Medicine was closely connected to symbolism, tradition, and observation of the natural world. People did not have access to scientific testing or modern medical research. Instead, they relied on passed-down knowledge, local customs, and trial and error. If a remedy appeared to work even once, it could quickly become widely accepted. Another reason such treatments were common is that options were limited. In a time when many illnesses had no clear cure, people were willing to try almost anything that offered hope. Even the most unexpected remedies could become trusted solutions. It is also important to understand that these treatments were not seen as strange at the time. They were part of everyday life. Healers, doctors, and ordinary people all participated in these practices, believing they were helping rather than harming. Looking back today, treatments involving mice highlight how different medieval medicine was from modern healthcare. They show how deeply belief, nature, and imagination influenced the way people understood illness. At the same time, these practices remind us of something universal: the desire to find relief and healing, no matter the method. Even the most unusual remedies were driven by the same goal that guides medicine today: helping people feel better. Imagine sitting in a quiet medieval room while a doctor prepares a small container filled with water. Inside, dark shapes slowly move. These are leeches, small creatures that played a surprisingly important role in medieval medicine. Leeches were widely used as a treatment for many different conditions. Just like bloodletting, their use was based on the belief in balancing the four humors. Doctors believed that by removing a small amount of blood, the body could return to a healthier state. However, leeches offered a more controlled and, in some cases, gentler alternative. Instead of using sharp tools, a leech would be placed directly onto the skin. It would attach itself naturally and begin to draw blood slowly. This process was seen as precise and effective. Physicians often chose specific areas of the body depending on the illness. For example, leeches might be applied near areas of discomfort or inflammation, based on the belief that they could help relieve internal imbalance. Leeches also had another advantage. They were easy to use and widely available. In fact, their demand became so high that collecting them turned into a profession. People would enter rivers and ponds to gather leeches, which were then sold to doctors and healers. From today's perspective, this practice might seem unusual, but interestingly, leeches are one of the few medieval treatments that are still used in modern medicine, although in a very controlled and scientific way. They can help improve blood flow in certain medical procedures. In the medieval world, however, their use was based more on tradition than science. Still, they were trusted and commonly used across Europe. From small villages to large cities, leeches became a symbol of medical care. The sight of a doctor using leeches might have seemed completely normal at the time. Patients trusted the process, believing that these small creatures could help restore balance and improve their condition. This treatment reflects an important idea about medieval medicine. It was not always random or chaotic. Many methods followed a system of logic based on the knowledge available at the time. Leeches remind us that even the most unexpected elements of nature were seen as tools for healing. And while the reasoning behind their use has changed, their place in medical history remains both fascinating and unique. In medieval Europe, medicine was not only about physical treatments. For many people, healing was deeply connected to faith. When someone became ill, the cause was not always seen as purely physical. It could also be spiritual. Illness was often believed to be a test, a punishment, or a sign of imbalance between a person and the divine. Because of this, one of the most common and trusted forms of treatment was prayer. Instead of visiting only a physician, people might turn to priests, monks, or other religious figures. Churches and monasteries became places not just of worship, but also of healing. People would travel long distances hoping to find relief through faith. Prayer could take many forms. Individuals might pray alone, asking for recovery and protection. In other cases, entire communities would gather to pray for someone who was sick. These moments were often emotional and deeply meaningful. There were also specific rituals connected to healing. Holy water, blessings, and sacred objects were believed to carry protective or restorative power. People might touch relics, light candles, or participate in ceremonies that were thought to bring them closer to recovery. Pilgrimages were another important part of this practice. People would travel to sacred sites believed to have healing properties. These journeys were not easy, but many believed that faith and determination could lead to recovery. From a modern point of view, prayer is often seen as a source of comfort rather than a direct medical solution. But in the medieval world, the line between physical and spiritual healing did not exist in the same way. Faith provided hope in a time when many illnesses had no clear explanation or cure. Even when treatments were uncertain, belief gave people strength and a sense of control over their situation. It is also important to understand that prayer was not seen as a replacement for other treatments, but as part of a larger system. People might combine physical remedies with spiritual practices, believing that both were necessary for true healing. In many ways, this approach reflects a deeper human need, the need to find meaning in suffering and to believe that recovery is possible. Healing through prayer shows us that medieval medicine was not only about the body, it was also about the mind, belief, and the powerful role that faith played in everyday life. Even today, while medicine has advanced, the connection between hope, belief, and healing still remains an important part of the human experience. In medieval Europe, not all medical treatments seemed unusual or unsettling. Some were based on something much more familiar, plants. Herbal remedies were one of the most common and trusted forms of treatment, used by both trained healers and ordinary people. Nature was seen as a powerful source of healing. Forests, fields, and gardens were filled with plants believed to have special properties. Over time, knowledge about these plants was collected, shared, and passed down through generations. Healers, often known as herbalists or apothecaries, spent years learning how to identify and prepare different herbs. Each plant was believed to have a specific purpose. Some were used to reduce discomfort, others to calm the body, and some to support recovery from illness. Herbal mixtures could take many forms. Teas, powders, oils, and pastes were all commonly used. Ingredients were carefully combined, sometimes following written recipes and sometimes relying on experience and tradition. Certain herbs became especially popular. For example, mint and chamomile were often used for calming effects, while garlic was believed to have protective qualities. These remedies were widely available and relatively easy to prepare, making them accessible to many people. Unlike some other medieval treatments, herbal medicine was often more gentle. It did not rely on invasive methods or unusual practices. Instead, it focused on working with the body in a natural way. However, it is important to remember that knowledge at the time was limited. While some herbal remedies may have been helpful, others were less effective or based on incorrect assumptions. Still, they represented an important step in the development of medicine. Herbal medicine also reflected a close relationship between people and nature. The environment was not just a place to live, it was a source of solutions. People observed plants, experimented with them, and slowly built a system of understanding. In many cases, this knowledge was preserved in handwritten manuscripts. These early medical texts included descriptions of plants, instructions for preparation, and notes about their effects. They became valuable resources for future generations. Even today, some of these traditions continue. Modern medicine still uses plant-based ingredients, although they are now studied and tested in scientific ways. Looking back, herbal remedies represent one of the most practical and enduring aspects of medieval medicine. While other treatments may seem strange or unfamiliar, the use of plants feels more recognizable. It reminds us that even in a time of limited knowledge, people were searching for natural ways to heal. And in many ways, that connection between nature and medicine has never truly disappeared. Looking back at these medieval treatments, it is easy to feel surprised or even confused by how unusual they seem. Methods like bloodletting, the use of leeches, remedies involving animals, healing through prayer, and herbal mixtures all reflect a very different understanding of the human body. But these practices were not random. They were part of a system that people genuinely believed in. In a world without modern science, individuals relied on observation, tradition, and the knowledge passed down through generations. These methods represented real attempts to explain illness and find ways to treat it. What stands out most is how strongly belief shaped medicine. The body was not seen as separate from nature or spirituality. Instead, everything was connected. Physical health, environment, and faith were all part of the same system. In many cases, people combined different approaches. A person might use herbal remedies, visit a healer, and also pray for recovery. This combination shows that medieval medicine was not limited to one idea. It was a blend of different ways of thinking. At the same time, these treatments reveal the challenges people faced. Without clear explanations for disease, even simple illnesses could become serious. This uncertainty led people to try a wide range of solutions, even those that seem unusual today. Yet, behind all of this was something very familiar: the desire to feel better, the hope of recovery, the need to understand what is happening to the body. These are the same motivations that drive medicine today. While modern healthcare is based on science and research, it is built on centuries of experimentation, discovery, and even mistakes. Medieval medicine, with all its unusual methods, played a role in that long journey. It reminds us that progress does not happen instantly. It develops over time, shaped by human curiosity and the constant search for answers. And perhaps the most interesting part is this: What seems strange to us now once felt completely normal, which makes you wonder, how will people in the future look at the medical practices we use today?